Hey, my name is Caleb, and today we'll be talking about gene therapy and how it can be used to treat a disease called LAD1. This has been a recent FDA-approved treatment as of March. So to understand the importance of this advancement, we first must understand the disease. So what is LAD1? LAD1 stands for Leukocyte Adhesion Deficiency type 1. Basically, that means your white blood cells are unable to leave blood circulation in order to fight an infection or any invading pathogen. This disease generally follows a common development going from a delayed detachment of your umbilical cord stump. And so generally it'll detach between 1 to 2 weeks, but those affected by this disease carry a lot more, like 3 to 4 weeks before their umbilical cord stump falls off. This disease also includes recurring bacterial or fungal infections of your skin and mucous membranes. So mucous membranes being your nose and mouth, things like that. And you'll also end up developing severe gingivitis and periodontitis. This is inflammation of your gums and the tissue surrounding your teeth. This can lead to permanent loss of your teeth, the falling out of your baby teeth and your permanent teeth. Overall, this disease follows some hallmarks of a lack of pus development and slowed healing in general. Those with this disease, if they choose not to get treated, have a life expectancy of around 2 years. This is considered a range because it's been shown that some can live only 1 year and some others live up to 5 years. However, the disease is very rare. It's about 1 per million people are affected. And in order to diagnose it, a lot of doctors will look at the symptoms, see that there's a lot of recurring infections, and perform a CBC or a complete blood count. They're looking for an elevated number of neutrophils. Though for an actual confirmation for this disease, they will do this through genetic testing. And now for what causes the disease, the etiology. The LAD1 is caused by a mutation of the ITGB2 gene. This gene codes for the beta 2 subunit of the beta 2 integrins. This is involved in CD18 and many other immune functions. The gene mutation is an autosomal recessive inheritance, which means that both your parents must be carriers of the disease in order for it to get passed down to you, and you must inherit both copies of this gene. So how does this disease impact your immune system? There will be a general decrease in MAC1 and LFA1 to begin with. MAC1 and LFA1 are both associated with the ability for white blood cells to leave the blood vessels and migrate into infected tissues. So with an overall decrease in that expression, your white blood cells lose their ability to escape the vasculature and help out infected tissue. MAC1 is also associated with complement-coated phagocytosis. So with a decrease in MAC1 expression, there's an overall reduced ability for phagocytosis, especially involving complement proteins. Your T regulatory cells also fail to regulate the immune system. So normally your Treg cells will bind to dendritic cells to reduce their co-stimulation and make dendritic cells less inflammatory. Treg cells will also release suppressive cytokines which suppress the immune system. However, under this disease, Treg cells lose the ability to bind to dendritic cells, which decreases the control over these dendritic cells and increases stimulation. This will increase your inflammatory cytokine release, increase co-stimulation of other T cells, and increase antigen presentation from dendritic cells. Overall, you'll also have neutrophilia. This is higher levels of neutrophils. Because you continue to have this persistent infection Your body keeps saying, oh, we need more effort to fight this infection. But your white blood cells, your neutrophils, are unable to leave the vasculature. And so you just keep producing neutrophils that aren't able to help. And that cycle continues over and over and over again. All right. And now let's look at previous treatments. One of the main previous treatments involved a chemotherapy regimen to eliminate some of your ongoing current bone marrow, and then a hematopoietic stem cell transplant. So this means that they take donor bone marrow from somebody else and transplants it into the affected child. The outcome of this disease could vary widely. There's overall a survival rate of around 75% of the procedures, and the treatment worked fairly well. It remained effective long term, but it had common complications such as graft versus host disease. This is where your donor cells are attacking the recipient's body, or you have graft failure, where your graft fails to survive. This treatment, while sounds great with its long-term effectiveness, has some limitations such as donor availability, graft versus host disease, and graft failure. However, there's been a new FDA-approved treatment. This treatment focuses on a gene therapy that collects the child's blood stem cells, the hematopoietic stem cells in their bone marrow. They use a lentiviral vector, self-inactivating lentiviral vector, to introduce normal ITGB2 genes to your stem cells. And then after they introduce the normal gene, the wild type gene, they are able to inject it back into the child after a round of chemotherapy. So overall, the outcome looks better. There, however, is still an adverse reaction to chemotherapy, but there is so far been long-term regain of immune function. So the immune system is able to pick back where it was and operate normally. And with the benefit of no graft failure and no graft versus host disease, because we're using host cells as the transplanted cells. Now, looking at the data of this study, they were able to use 9 patients within this study from all around the world. And as a result, they saw 0 immune rejections or graft failures. They saw a drop in infection, a severe drop in infections, such as infection-based hospitalization dropped 74.45%. The prolonged infection-based hospitalization dropped 81.95% after this graft, and the pre-specified serious infection rate dropped 84.90% lower than it was before the transplant, before the graft. And as you see on the right, you get to look at their analyzed data. Both, you can see the drop in hospitalization rates between infections, prolonged infections, and pre-specified serious infections, as well as look at the individual patients for the years before the study and years after this gene transplant, this gene therapy, to see the frequency of their hospitalization-based infections and just the frequency of infections in general. You see an overall decrease in recurring infections. So why should you care? What's the significance to science? Overall, it's been brought up that there are downsides to the study, such as no long-term study, no long-term observation on the side effects of this treatment. However, the researcher conducting the study promises to observe the kids for the next 15 years, or as long as consent is applied, and really look for any long-term effects. But so far, it's been very promising in prove and restoring immune function that is long lasting. Another downside to this study is that chemotherapy is still required. While chemotherapy is required, it can be harsh towards kids, especially around the age of 1 to 2. You can have some very adverse side effects, and so that's still a downside towards this treatment. But the benefits probably outweigh these downsides. There's no donor requirement. You don't have to sit on a donor wait list for years and years on end while you're just getting worse and worse with recurrent infections. And there's been a high success with no observed graft failure. Within their study, they've seen no graft failure, no failure for the tissue to take root within your body again, and no graft versus host disease, which is a major improvement from the previous treatment. And why should you care? Again, this is a major advancement towards gene therapy. This really shows the success of what gene therapy can do in treating genetic diseases, especially ones that are affecting kids. So it opens the door for what other diseases can be treated or even cured utilizing this therapy method. And it gives hopes to infants and parents who are just sitting on that donor list waiting for a new transplant, waiting for somebody to match. And so yeah, this is a new FDA approved drug. It's really cool, worth checking out yourself. It's been really fun to research, and thank you for coming to my TED Talk.